Hey, I'm Betty Cannon with the Ashurst Cannon team, Remax Properties in Montgomery. And today we are with Dwight Leary of Home Check Inspections.
Hello.
And Dwight is a fourth generation home builder.
That's correct.
And a master home inspector. And I read where you have done over 11,000 home inspections. Is that right?
It's actually over 12,000 now.
Okay.
But we've quit counting, so.
Yeah, that's great. That's awesome.
Makes you feel old.
Well, I recently saw on Facebook where you posted that you had completed this international training course called COVID-19 Safety Guidelines for Home Inspectors.
Yes.
So I thought, gosh, that just raises so many questions and how we can educate the public, buyers, sellers, realtors, just anybody out there. So I wanted to see kind of what made you want to take this course.
Well, we're getting about 10 emails a day from everybody from our accountant to our insurance agent telling us all these things that we need to be doing to protect ourselves and to protect the public from the COVID-19 pandemic. So obviously it's on everybody's mind, and I didn't really know, where do home inspectors fit into the overall risk scheme.
Right.
So I've been very interested, and then when INTERNACHI, which is the International Association of Certified Home Inspectors, of which I've been a member for many, many years, and they have tremendous education programs. When they posted on Facebook that morning that they have come out with this course, it's a 5-hour course. It doesn't really take quite 5 hours, but they give you 5 hours of continuing education credit.
Okay.
It was perfect for what I was looking for.
Mm-hmm.
So,
Well, tell me, what are the steps that you're taking to implement the guidelines that you learned in this training? And we may need to speak up a little bit too with traffic going by. So.
well, one of the biggest steps that we've had to take is to ask people not to be at the home inspection.
Now that's different, isn't it?
It's totally different. We've always encouraged our clients to be there. They're paying us for information. You can give them a lot of good information in person that's kind of hard to do in writing and in the written report. It's not in the format of the report. It gives the home buyers a chance to really take a closer look at the property than they did possibly, before they negotiated the contract. Sometimes they want to bring their parents or their brother or somebody to look at it.
And it's a good time just to have another closer look, like you said.
Yes.
But you're recommending that they don't come, or?
Well, according to the Center for Disease Control standards, home inspectors fall into the lowest risk category. But that is operating on the assumption that there will be nobody present when we do our home inspection. So as long as we're not sick, there are no other persons there, then we're not really at very much of a risk. So that's where we need to be. Otherwise, we're going to have to start wearing the masks, the gloves. We do our reports on our handheld devices now, so
that can carry a lot of germs, can't it?
It can, and it's also difficult to operate with gloves on. So
now we have a big truck going by that we're going to cut this out.
yeah.
We won't even try to talk over that. Okay, I can cut that out. So, I know, we'll let it go, huh? So you use the handheld devices to do your report.
Right.
And that carries a lot of germs.
It can, because we're having to touch a lot of what we call touch points in the inspection process. Thermostats, faucet controls, doorknobs, just a lot of things.
Well, I think toilet bowls.
Well, I didn't want to talk about that.
Okay,
but,
I'm sorry I brought that up, but that's real, right?
Yeah,
We're going to be real here. We're trying to.
We are professional toilet flushers.
Oh,
so,
wow.
And we're doing this on our handheld device, so then you have to make a phone call. You're putting that to your face,
Right.
and it just this course brought to focus a lot of ways that we can reduce the risk. So we are bringing the little alcohol-based wet wipes.
Mm-hmm.
We have alcohol sanitizer,
Mm-hmm.
soap, of course the house has water, or we're not inspecting it, and paper towels. So we are washing our hands almost not constantly, but regularly. And we are sanitizing our phone, our flashlight. We have several cameras. We're constantly wiping those down with alcohol wipes. So that, number one, we want to protect ourselves.
Right.
We don't want to take any of this home to our family. But we also, the things that you do to protect yourself are also protecting the public. So
Right.
we definitely don't want to be an agent in the spread of this if we can possibly help it.
Right. So I wanted to ask you about how receptive these new guidelines have been. Like when you tell a buyer that it's really better for them not to come, or the seller, if you've got 10 people in the house because they're home from college, they're furloughed from work, and you tell them it's better if they leave the house. How receptive has all this been?
So far, pretty good. A couple of people, especially the homeowner, sort of bow up at first and say, "Why would I have to leave my own house?" And
Yeah.
it is awkward asking somebody to leave their own house. But once we say, "Hey, we are operating under what we call best practices for home inspectors during the COVID-19 pandemic," they immediately are cooperative and they say, "Okay,
Good.
I totally understand."
Education is so powerful, and if we take time and explain, that's why we wanted to do this this video, to just explain about the importance and how it's impacting a lot of people, whether they're buyers, sellers, home inspectors, realtors, just the general public. Question was, how difficult has it been to get supplies? All these supplies that you need now, like people can't even find toilet paper.
Yes, it's.
I can't find any alcohol wipes. Where are you? I mean, what's the deal?
Fortunately, a certain lady who's very near and dear to me always has a stockpile of some of these things. If it weren't for that, we would probably be scrambling around.
So you're networking with people you know that may have some supplies. That's
Yes.
great.
Fortunately, under the CDC guidelines, we are not required to wear masks or gloves. We do have some gloves, and occasionally when we're dealing with something, we do put the gloves on, but we are not required to wear those. However, we're trying to protect ourselves so that we are not, forced into that position of having to wear masks, because we want to save those for the people who are in healthcare.
That's great. Do you have anything else that we didn't talk about that you want to mention, or any parting words of wisdom or anything?
I'm not sure about wisdom, but one thing, as far as our client coming to the inspection, we don't mind them coming at the end of the inspection. We're happy to stand outside in a setting like this, 6 feet apart, and discuss our findings. And on some of the things, we can actually show them. We're not going to go back and open up electric panels and show them.
Well,
things.
you have pictures of
We
things
have
too,
pictures,
so you can
that's
show
right.
the images that way.
That's right. So, but a lot of the buyers, they had a contractor they wanted to bring by. They had a carpet person or things like that. So we're telling them, hey, work this out with your realtor, and our time can overlap a little, and so that we can discuss our findings. But we want to be out of there when everybody else is coming in. We do not want for home inspectors to be moved into a higher risk category.
Okay.
It would just totally make things difficult.
That would make it really hard, really
would.
challenging.
So.
And there are people out there that still need to buy a home because they're relocating for different reasons, and so we need to be available. You need to be available to have the home inspected. And we wanted to thank you so much for talking with us about this today. And thank you for watching. If you have any questions for Dwight, just put them in the comments below when I post this, or questions for me, and we will get back with you and answer this. And we just want to thank you again and wish you blessings and be safe.
Amen.